Hello, my name's Rachel. I'm the Practice Development Midwife here at Queen Elizabeth Hospital.
Hi, my name is Tamar. I'm the Antenatal Clinic Lead Midwife and the Research Midwife here at the Queen Elizabeth Hospital.
So we're making this video for you to try and address some of the concerns and questions that we know pregnant women have about receiving the Covid-19 vaccination during their pregnancies. You may have seen last week on Edie the e-midwife, we put out a call for any questions that you had that we can hopefully try and address in this video. But before we delve into the questions, we want to be really clear on what the professional viewpoint is regarding vaccination during pregnancy. Earlier this year, the JCVI, which is the Joint Committee for Vaccination and Immunisations, released a statement in which they very clearly recommended that all pregnant women should receive vaccination against Covid-19. This was following evidence presented to them by the Royal College of Obstetricians and Gynecologists, so those are specialist doctors in pregnancy. And as a result, our professional body, the Royal College of Midwives, has made the same recommendation. So it's a really clear and definite message from us as midwives, as healthcare professionals, that we recommend that all pregnant women should receive the Covid-19 vaccination. At the same time, we know that there is a lot of concern about vaccinations in pregnancy in general, and unfortunately a lot of misinformation regarding the Covid-19 vaccination. So we're really hoping that by making this video, we can clear up some of the myths around it and answer all the questions that you have. So, first question please, Tanya.
Someone has asked us, Rachel, what increased risk do I have of getting COVID when pregnant?
Okay, so to be clear, pregnancy itself does not put you at increased risk of contracting the virus. What we do know is that if you contract COVID in pregnancy, particularly in the third trimester of pregnancy, so any time after 28 weeks, you are unfortunately at increased risk of becoming severely unwell, sometimes to the point of needing hospital admission. A study was conducted in the UK looking at hospital admissions amongst pregnant women with COVID between May and July. And this study found that 171 pregnant women were admitted to hospital with COVID symptoms during that time. Of those women, 98% had not received any COVID vaccination at all. 2% had received only one vaccination. And so you'll realise that none of the women that were admitted to hospital had been vaccinated twice. So although that's a fairly small sample size, it seems to demonstrate that vaccination is very protective against admission to hospital with severe illness during pregnancy. What we know also from that research is that having COVID in the later stages of pregnancy does increase your risk of certain things. This includes preeclampsia, premature birth, and unfortunately stillbirth also. We realise that these are really scary things to be talking about to pregnant women. We need to stress that although the risks of stillbirth and premature birth were doubled with women that had infection of COVID in pregnancy, those risks do thankfully remain very small, particularly if you seek medical attention at the right time. Another important point to note about premature birth, it's not that COVID will force your body into premature labour. It's that when women are very unwell with COVID, we sometimes need to make the difficult decision to deliver their babies early in order to help mums get the best possible treatment to give them the best chance of fighting off the virus. So these are really difficult things we're talking about, I understand, but we want to stress how important we think it is that you do take the vaccination during pregnancy. Tamara, I've got a question for you now. What research is there about the vaccination during pregnancy?
That's a very good question, and it's a question that we as midwives do get asked a lot, so thank you for that question. Thus far, there has not been any studies on the safety of the vaccination specifically on pregnant women. However, in the US and UK, nearly 200,000 pregnant women have been vaccinated now with no safety concerns raised. COVID-19 vaccines that we are using in the UK are not live vaccines and so cannot cause COVID-19 infection in you or your baby. We have been using some vaccines quite safely in pregnancy for many, many years. For example, the whooping cough vaccine and the flu vaccine, which we know are very safe to give in pregnancy, and also have no live vaccines. The Pfizer and the Moderna vaccines are the ones that we know most about, and consequently, it is those that we are recommending for pregnant women.
Fantastic, thank you.
So Rachel, someone has asked us, can you have the Covid-19 vaccine after you've given birth and whilst you're breastfeeding?
Yeah, absolutely. If you're a breastfeeding mum sitting at home watching this video now, we really recommend that you have the vaccination. There is no known way in which ingredients from the vaccine can pass through the milk to your baby, but there is some encouraging research to suggest that if you are vaccinated while breastfeeding, actually you can produce some antibodies which can pass through the milk to your baby. So that's really good news. If you're breastfeeding, you can have any of the brands of vaccine available. But what we want to make really clear is we do not recommend that you delay vaccination until after your baby is born. We know, as we've discussed, that the third trimester of pregnancy is the time of greatest risk for you and your baby. And so we must recommend that you have your vaccination in pregnancy rather than waiting until afterwards. Another question here, Tamwa. Somebody is asking, would we really recommend a vaccination in pregnancy when we don't even recommend anything stronger than paracetamol?
We would highly recommend the Covid-19 vaccination. Paracetamol is a painkiller and therefore a completely different medication to a vaccine. Stronger painkillers do have a proven safety record in pregnancy. However, we only use this medication if it's absolutely necessary and it has to be prescribed. Severe illness caused by the Covid-19 would require intensive treatment and multiple medications, and of course is best avoided if possible. And so the vaccine is highly recommended.
Thank you. Next question for me.
Yes, it is for you, Rachel. So someone's asking us, when is the safest time in pregnancy to have the vaccine?
Excellent. So the easiest way to answer this is to say as soon as possible. If you're watching this video and you've just recently found out you're pregnant and wondering what to do about the vaccination, our recommendation would be that you go and have it as soon as you are able to. As we've said, the third trimester of pregnancy is the time of greatest risk, and we know that double vaccination offers the greatest protection. So it's best to ensure that you have had your second vaccination before you get to 28 weeks. You're probably aware that it's recommended to have a gap between the vaccinations of 8 to 12 weeks, and so you can see that the sooner you have your first vaccination, the sooner you can have your second, to ensure that you are protected before you get to that third trimester. So short version is as soon as possible. Next question for you. Actually, it's not a question, it's a comment, Tamwa. Somebody is commenting that people with diabetes should be aware that the vaccination can cause an increase in their blood sugar. What would you say to that?
So there are no current evidence that the vaccination can cause an increase to your blood sugar. Gestational diabetes is one of the complications of pregnancy. COVID infection itself and medications that we use to treat COVID can indeed impact and have an effect on your blood sugar, but the vaccine itself cannot. People with diabetes in pregnancy are more at risk of having catching COVID-19. Therefore, we do recommend that women are vaccinated during pregnancy.
Absolutely.
So Rachel, another question that we've been asked is, what are the side effects of the vaccine, and is it really worth having the vaccine?
Yeah, great question. Of course, if you're going to be putting any medication into your body, you need to be aware of the possible risks and any possible side effects. Now, what we know is that vaccination in pregnancy is not going to cause any side effects that the general population would not also experience. These side effects are quite commonly documented. You might have heard about them. They can include pain or tenderness at the site of the injection. They can include a feeling of being generally unwell for a day or two afterwards, And some people report that they've even spiked a temperature after having had the vaccination, a mild fever. So those most commonly documented side effects are exactly what you might expect as a pregnant woman. There is no evidence to suggest that there is any other risk of vaccination during pregnancy. I hope that's really clear and offers you some reassurance on that subject. Somebody has asked, what if they're trying to conceive? Should they have the vaccination?
Yes, there is no evidence that vaccination has any negative impact on fertility. So if you're trying to conceive or having fertility treatments, please, now is the great time to have the vaccination. That'll be my answer to that question.
Thank you.
So Rachel, final question. Someone's asking, the risk of miscarriage is doubled, and what does this mean in real terms?
Okay, I think what this person is asking about is the research that suggests that there's an increased risk of stillbirth in women that have Covid-19. To be clear, there is no evidence to say that women who have had the vaccination have increased risk of miscarriage or stillbirth. The evidence is actually around women who are unwell with Covid-19 in the late stages of pregnancy. And yes, unfortunately, it does suggest that those women are at increased risk of stillbirth. Doubled risk, in fact. I know that's very frightening to hear as a pregnant woman in the midst of a pandemic, but I want to reassure you by saying that although the risk is shown to be increased, the risk is still very small. It's still less than 1%, and I hope that provides some reassurance. This is really part of the reason that we're making today's video. We want to reduce your risk to as small as we possibly can, and that's why we are so strongly recommending vaccination during pregnancy. We recognise, however, that this is such a personal choice, and there will be women watching this video thinking that they do not feel convinced that the vaccination is right for them. Thelma, what recommendations would you have for those women who don't wish to be vaccinated?
So my recommendations will be to continue to wash your hands regularly, face, wear a face mask, space, continue to maintain social distance. And also if you're a pregnant woman and you're working, ensure that your employer carries out a COVID risk assessment just to help you minimise the risk of catching the COVID in pregnancy. And if you are a pregnant woman in your 3rd trimester, limit your social contact as well. And most importantly, if you test positive to COVID at any time during your pregnancy, please let your midwife know.
Fantastic, yeah, that's great advice. So I hope that we have managed to offer some clarity, some more information and some reassurance as to the vaccination against COVID in pregnancy. And to be really, really clear, it is our firm recommendation that you do go ahead and have the vaccination, whichever stage of pregnancy you're at, but ideally the sooner the better. We've made reference to lots of research during this video, and so we're going to pop the links to those research papers in the chat box below for you to read yourself. If this video has thrown up any other questions for you, feel free to ask them via Edie the e-midwife, or indeed ask them of your own midwife when you have your next appointment in clinic. We really want to give you all the information you need to make the right choice for you and your baby. Thank you so much.
Thank you.